When you have limited resources, it becomes even more compelling to make sure you're using them on programs that are proven to be effective. And supportive housing clearly is that. 89% of residents who get into a supportive housing environment stay housed. That's huge success.
In Springfield, we are really struggling to continue to fund these kinds of models. But with the federal government and the community and housing providers partnering with us, it makes it a really good, cost-effective model. It's a small check we write for a big return.
Recently there was a study done of 177 supportive housing residents, and it looked at how much public service they were using, was getting spent for them 2 years before they entered supportive housing, and then again 2 years after they entered supportive housing. And what was found was that on average, a yearly reduction of $2,400 in how much people were having to use services. And it's because you no longer had to have as many days in an emergency room because they were staying healthy, they were getting the services they need, fewer days in jail, fewer Medicaid costs because again they were getting preventative and wellness services, fewer mental health and substance abuse treatment kinds of costs. The list goes on. So it's a very proven effective program.
In the next 3 to 5 years, we have made commitments to move thousands of people out of the nursing homes and into the community setting. I think that we're very confident that the idea of doing patient-centered planning will assure that when they're in the community, they will have a much better life with more independence than you can in an institutional setting.
I think as we're moving people out of institutions, you can't necessarily just put them out there on their own in an apartment. And having this transitional kind of environment where they're still getting the services they need and somebody who's watching out and helping them get independent is just a critical part of the mix.
I think that it's so easy to fund this program because it's such a small amount of money for what you get.
Overall, our experience has been, and that of other states, that community care is less costly than institutional care.
I think supportive housing makes the case that it's the good dollars and a good investment.